More than 1.2 million people are either living with or in remission from a blood cancer in the United States, and among the most deadly of all of the blood cancers is acute myeloid leukemia. It kills more than 10,000 patients in the United States each year. On the heels of the American Society of Clinical Oncology annual meeting, we've got Dr. Luis de Janeiro here to take a look at the latest medical advancements, along with Laureano Hernandez-Aldama, who is here to share her inspiring story. Thank you both so much for joining us.
Thank you.
Good morning.
Dr. de Janeiro, on the heels of the meeting here, what's the big news that you took away from the meeting?
A couple of great things coming out of the American Society of Clinical Oncology, which is the world's largest meeting of cancer researchers and physicians. The first is in the area of what we call immunotherapy, using the patient's own immune system to find and attack and eliminate the cancer. It's really Star Wars medicine, and we've pioneered it in the blood cancers, but now it's paying benefit for patients with other forms of cancer as well. I think the second thing that I found exciting at the meeting was the ability to use a single drug that targets a single bad-acting gene, and use that drug to treat many different forms of cancer, no matter where they occur in the body.
And I want to toss it to Laureano real quick. Laureano, what is your story? You are a cancer survivor. Can you share a little bit about that with us?
I'm a cancer survivor, and I'm a former TV news anchor and fitness and health reporter. I was in TV for 20 years until my diagnosis, and then everything unraveled. But really, my story could be your story or anybody else's story, and that's why I'm here today, because I really feel like that's my new purpose and my new mission. I was diagnosed, I was in the best shape of my life, or so I thought. I was in the middle of a fertility treatment to have a second baby, and the fertility doctor said, "You can't have a baby, you have cancer." And I went into shock. Then I called LLS because I had been involved with them before, and they've been so supportive, and they really steered the ship for me and helped remove a lot of the noise and the anxiety. And within 36 hours, I had chemo running through my veins, and I was at Johns Hopkins. I left my job in Austin, Texas, and I was hospitalized for a year. But what really was the biggest story that I felt like I had never covered in my entire career was that this form of blood cancer, AML, acute myeloid leukemia, that the treatment hasn't changed in 40 years. And I said, what does that mean? How can you tell me that and look at me in the face and say that when I have a 2-year-old, you took away from me, and you say I may not live to even see him, but if I do, I'm going to be very broken because there's a lot of chemo involved. There hasn't been progress in the past 40 years. All of that was just unacceptable to me. And immediately, I just felt like I had to have a voice and a new purpose. And that's what I did. I started filing reports from the hospital bed because I felt like I needed to be transparent and put on my reporter hat, as I'm sure you would do and anybody else. I started to dig for answers.
Well, thank you so much for sharing your story. I have to say, you look beautiful and amazing. How do you feel today?
I'm broken. I go through depression, PTSD. I've gained 40 pounds from steroids. I have shingles. So I do have a long list. I don't want to be like the Debbie Downer here, but that's another reason we need these breakthroughs. We need more people to live, and those who do live have a better quality of life and suffer less. And that's why I have hope, and I believe that we're just on the cusp of something big happening. I have a vested interest for my own son, but I feel like this could be anybody's story, so I hope that people take time to get involved with the Leukemia and Lymphoma Society.
Thank you so much again for sharing that story. We're out of time, but I want to make sure that anybody who's been affected by blood cancer knows where to turn for that support. So where would you send them to learn more?
Yeah, best place, the Leukemia and Lymphoma Society website, lls.org. And if they're a patient, we can help them now. They should call our 800 number, 800-955-4572.
Thank you both so much. And again, if you want to learn more about what they talked about and more about Laureano's story, we're going to have this interview posted online, and you can get that resource right there at fox4morningblend.com.